Welcome back, everybody. This is Kristen Marie, certified sex therapist, bringing you the next myth in our Sex Myth series, where every week we are taking down one annoying sex myth after another. Together we will discover what the real truth is. Alrighty, for this week's myth, it's only women can have painful sex. Male sexual pain does not get near as much attention as female sexual pain, and there are likely multiple causes for this, but one major one is likely that male sexual pain disorders are a bit more rare and often can be localized to a more specific medical or physical cause. Another potential reason is, it was found in a study that said that many urologists may overgeneralize different pain conditions into just one category, which is prostatitis, when in actuality there are better explanations than quickly ascribing prostatitis as the culprit. Men can experience sexual pain anywhere from their thighs to their lower abdomen. Depending on the condition, some can experience pain or discomfort in their testes, perineum, and the penis. While this pain can obviously impact sexual activity, many men also report other activities such as walking, sitting, standing, running. All of these can be impacted by depending on what condition is going on as well. So prostatitis, also known as chronic pelvic pain syndrome, is an inflammation or infection of the prostate gland, which can cause swelling and pain in the area behind the penis. This can also lead to painful urination and ejaculation. I think what a lot of people don't know is that prostatitis can be something that up to 50% of men will experience at some point in their lives. So it's a pretty prevalent condition that needs a lot more awareness and a lot more education in terms of how to identify the symptoms and leading to treatment. And there is some good news, it depends on what you might believe to be good news, but some good news is that research continues to support that one way to prevent prostatitis is to ejaculate regularly. More specifically, the folks over at the American Prostatitis Association write, lack of sexual activity can also lead to chronic prostatitis. According to some experts, semen can accumulate in the prostate. If it's there too long, it causes inflammation, so it's important for men to ejaculate regularly. How much is regular, you ask? Well, the American Prostatitis Association suggests at least once per week. As always, though, if you are worried at all about your medical condition, and before you take matters into your own hand, do not hesitate to run this all by your medical provider. They, I'm sure, will be able to provide you with sufficient information for you to know how to maintain optimal health. So another male sexual pain disorder that I wanted to cover is Peyronie's disease. Peyronie's disease is when fibrous tissue growth takes place within the penis. This can have biological origins or originate from trauma to the penis. It impacts the shape of the penis, causing some curve or indent. If curved too much, intercourse can be impossible, extremely painful. This can lead to erectile dysfunction and quite a bit of penile pain. Potentially 5% of men, I think, experience this. But then again, it's kind of hard to tell because it's assumed that this is a wee bit underreported due to it being a subject matter that is hard to believe that everyone experiencing this might be coming forward and reporting this to their medical providers. And a couple other conditions that I wanted to throw out there that can lead to sexual pain in men are UTIs and yeast infections, which symptoms can be some itching in the tip of the penis. STIs and psoriasis, those can also cause quite a bit of pain. But again, if you are experiencing any of these, please go to your medical provider or a specialist if that's what you feel might be right for you, so that you can get an accurate diagnosis and begin treatment, leading to hopefully relief of your symptoms. And a couple more quick tips for getting into treatment. Find your team. The the right specialist is out there for you, try not to let insurance make the call. Start researching specialists or asking for referrals for whatever conditions might be you believe might be going on. Here, I just wanted to list really quick some potential specialties that might be involved. Urologists, dermatologists, pelvic floor physical therapists, pain specialists, neurologists, and sex therapists for the mental health piece, because there are quite a bit that experience a lot of distress due to the ongoing pain that they've been experiencing, whether personally or in the relationship. Alrighty, that's all I have for today's myth. Thank you so much for watching, and I hope you continue to enjoy the information that I'm sharing here. And by the end of the year, who knows? You might end up just feeling a wee bit more sexually informed. Alright, rock on.